Hello, everyone. My name is Mireya Piña, and today I will be presenting on how food justice impacts priority populations' health. And so we'll be taking a look at food equity, priority populations, health, and we'll be doing this by looking at food sources for low-income communities. Interventions on behalf of institutions and local entities are key components in improving health disparities through food justice initiatives. National data and studies conducted by professionals reflect that marginalized groups tend to have higher rates of obesity and diabetes linked to diets, specifically among younger demographics. Millions of individuals receive substantial portions of their daily calories from government-funded nutrition programs. These government-funded nutrition programs are underfunded at times and influence eating behaviors that result in disease for kids. Partnerships between federal and local agencies are necessary to decrease communities at risk of illness. So here we'll be taking a look at how food justice impacts priority populations' health, and through this, through social determinants of health. So we have 5 of those, which include education, healthcare and quality. If we look on the right, we have social and community context, economic stability, but food security specifically falls under neighborhood and built environment. So the area we live in very much has to do with the kind of food we're going to be getting. So with that being said, I'll go ahead and continue on to the next slide. And food, we have food scarcity and diabetes. So if we look on the right, we have 38 million people in the United States experience hunger in 2020. And if we look here on this, this figure, if we look up here in the center, so it's a cycle of food insecurity and diabetes, which happens to be a vicious one and a very difficult one to get out of. So if we start up here with food insecurity, if you're not receiving, you don't have access to it, you're not receiving the right items, eventually, it creates an imbalanced, inadequate dietary intake, which means that we are not giving ourselves the proper nutrients we need, which then leads to chronic illnesses, stress, diabetes, and then, how well are we able to control diabetes when we don't have the proper food to do so? And then from there, we have increased complications from not being able to manage the chronic disease. And then you're going to need increased health utilization, which comes with bills and stress. And then again, we're up at this low income in the upper left. And then again, if you're lower income, then you're probably going to be in it's most likely that you'll end up being food insecure, and that cycle continues. Unfortunately, we're seeing this a lot with specific groups, especially among the younger kids, based on the kind of programs that they are eligible for to supplement their nutrition. So I'll go ahead and move on to the next slide. And here we have a little bit of food justice, public health concern. And I just want to kind of specify specifically, food justice also has to do with the access we have to food, advocacy around food. There's a lot of groups that are feeling very passionate, especially after the pandemic and the amount of children that weren't able to receive their lunch meals. There was a large decrease of 225 meals that were not picked up in a week. Food literacy is very important. Do people understand the labels of the items that they're getting? Would we be more cautious if we knew how to read the labels properly? Security, how dependable is that food source? And diet, right? How is that food impacting our health? So if we take a look over here, again, those are the ethnic groups. And then we see in the blue, before the COVID-19 pandemic, those groups were already, affected by food insecurity. We see it less in the white communities. And then during COVID-19, we have also that big increase in food insecurity. So, but if we really look, it's like a wave. But even for the Black communities and the Hispanic communities, they stand out, and there's that really high increase in general. But with the COVID-19, it's just a highlighted increase. So we'll go on and move on to the next slide. So here, I want to talk a little bit about the school meal programs, the free and reduced meals. There's the school breakfast program, and there's also the national school lunch program. Normally, if you qualify for one, you tend to be qualified for the other as well. And there's a little bit of the poverty guidelines that children need to be in within their family income must be between that poverty line for them to qualify for it to be either free or reduced. There are some dietary guidelines for Americans that are suggested. Those are a little bit concerning, and I'll be talking a little bit more about that in a second. But if we look at this graph, I just wanted to bring your attention to it. So we can see a big increase in the amount of students that are participating in the lunch program. We also see in the red how many of those students are receiving their lunches for free or reduced. And if we take a look, for example, at 1975, there's a lot, less students depending on lunch meal programs, but there also seems to be, so it seems to be higher in 2019. And then we also see like less and less kids. It's becoming a program for kids that get free lunch. If we take a look up here. So we'll go ahead and move on to the next slide. And so here we have the dietary guidelines for Americans, and the CDC recommends that 10% of the daily added sugars, 10% of the calories are from added sugars. And if we take a look here at the breakfast guidelines, what they have and how much added sugars they add, we see that skim milk has the largest portion of added sugars. I also did notice a lot of condiments such as like ketchup, and if we're looking at jelly, all these small things actually have a big impact because they have a lot of sugar in comparison to other things such as like protein. So that in itself, the flavored skim milk is like 200% over the limit, 200% over the limit for what's suggested in one day. So these are some of the things that some of the students are eating. Let's remember that a lot of the students who participate in these programs are low income, are from marginalized backgrounds. So we'll be able to see some of those effects here shortly. So right here we have a percentage of obesity among children. So if we take a look on the left, about 25% of children between 6 and 11 years of age, they are obese. And we see that big difference again in the white communities. There's about 14% of kids between those ages are obese. So there's that difference. And here in this graph, we can also see the difference in ethnic groups. There's a white ethnic groups coming in at 8 that are diagnosed out of every 100. And then over here, we see that increase with the Hispanic community at coming nearly 14 people out of 100. So that's a big jump. And we could kind of see that, make that connection between the school lunch programs for kids and these increases in diabetes. So I'll go ahead and continue. And some interventions that are taking place are the national school program. They waived a lot of policies in order to allow people to pick up lunches in areas in order to make food more accessible. And then we have food banks. They've come up with new strategies to get food into the hands of individuals that need them. And of course, partnerships are very important. So we have Feeding America, we have different food banks all getting together to reach those rural communities. So I'll go ahead and talk about future directions. There's FRESA. So it's a new coalition started by community members who are advocating for food access. And There needs to be some emergency plan given that things are unprecedented and food is so essential to our health. Lastly, community health education is very essential to move forward in a positive direction where we can decrease disease among kids. So that brings me to the end of my presentation. I want to thank you for hearing me out.